Imagine a world where we can gently nudge the very core of our reward system, influencing how we learn and make choices. A groundbreaking study has achieved just that, marking a significant leap in neuroscience. The nucleus accumbens, a tiny but mighty part of our brain, is the key player here. It's the brain's pleasure center, lighting up when we experience something enjoyable and guiding us to repeat behaviors that lead to rewards. For the first time ever, researchers have successfully altered the influence of the nucleus accumbens on human behavior using transcranial ultrasound stimulation, TUS. This non-invasive technique, applied for just over a minute at a time, is like a gentle brain massage, influencing how people learn the connection between cues and rewards. Participants became more likely to repeat choices that previously paid off, showing increased learning rates after positive outcomes and making positive choices more quickly. But here's where it gets exciting. Until now, such effects were only achievable through invasive surgical procedures like deep brain stimulation, DBS, where electrodes are directly implanted into the brain. The current study suggests that TUS could be a beneficial, non-invasive alternative for treating neurological or psychiatric disorders such as addictions, depression, and eating disorders. The study, published in Nature Communications, was led by researchers from the University of Plymouth, with contributions from the University of Oxford, John Radcliffe Hospital, University Hospitals Plymouth NHS Trust, Brown University, and the VA Providence Healthcare System. Professor Elsa Faragnan, the study's lead researcher, highlighted the significance of these findings. For decades, the nucleus accumbens has sat at the center of theories of motivation and reinforcement learning. We were able to pinpoint a clear link between a specific learning trait, tied to impulsivity, and a structure that until now could not be reached without surgery. The fact that we can now modulate this area non-invasively, and in a personalized manner, opens extraordinary possibilities for clinical translation. This research is part of ongoing work at the University of Plymouth exploring the potential of TUS for conditions like anxiety, depression, addiction, and other neurological and psychiatric disorders. How did they do it? The researchers recruited 26 healthy participants who visited the BRIC facility 4 times. The first visit was for planning the TUS intervention, followed by 3 sessions where TUS was applied to different parts of their brains. Roughly 10 minutes after the ultrasound intervention, participants performed a series of tasks for about an hour while the research team monitored their behavior and brain activity. The participants' performance was compared to patients with DBS electrodes targeted to the nucleus accumbens. The results showed that while DBS often normalizes reward-seeking behavior, TUS had an opposite and excitatory effect. However, both result in people's learning and reward sensitivity being altered, Professor Faragnan stated. This study is the most significant I have had the privilege to lead so far. It marks a turning point for neurotechnology, showing that a non-invasive ultrasound approach can influence behavior and may one day help restore mental balance. This study opens up incredible possibilities, but it also raises some interesting questions. Could this technology revolutionize mental health treatment? What are the potential long-term effects of using TUS? And this is the part most people miss. Could this technology be misused? And what ethical considerations should we keep in mind? What are your thoughts on this breakthrough? Share your opinions and questions in the comments below.